Welcome to the Gastro Girl Podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone, welcome to this episode of the Gastro Girl Podcast. Today we're going to be talking about a very important topic, chronic constipation, but not only what chronic constipation is, but we have some really interesting insight about a brand new treatment option that is going to blow your mind. It is a capsule that you swallow, and it kind of helps you move your bowel so you don't have to suffer from chronic constipation. And we're going to learn all about that as a treatment option. And we welcome Dr. Monia Werling. She is a gastroenterologist in Greenville, South Carolina, as well as her patient, Misty. Thank you both for joining us today.
Thank you very much for inviting us.
For those of us who are watching on YouTube, we want to show you this quick video on how the Vibrant capsule works. Take a look. And for those of you who are listening in our audio versions, you'll hear the audio, but if you want us to actually see the video, please check us out on our YouTube channel.
Let's talk about chronic constipation. It is really affecting your life. Current medicine is too unpredictable. Life seems to slow down. When was the last time you were spontaneous? At dinner with friends, just because. Went on a hike or to the gym without fear. You are not alone. Vibrant, innovative, non-drug treatment creates new hopes for you. Science shows that when the biological clock and the bowel are not synchronized, it may lead to constipation. Vibrant can change that. You simply activate the non-drug capsule in the pod and swallow with a glass of water. The capsule will gently stimulate the colon, synchronizing your biological clock, allowing the bowel to improve its natural function. Now you have a choice. Choose better life. Take control and live the life you wish for.
So let's get right into it. We get so many questions, as I'm sure you have, you're very active on social media, about chronic constipation. This is one of the number one struggles I think so many people have been dealing with. And we're just going to really explain. And we also do a lot with IBS-C, IBS with constipation. So Let's just kind of help people understand the differences. So first of all, what is chronic constipation and how does that differ from other forms of constipation?
Okay, so chronic idiopathic constipation is a type of constipation that you don't find a specific reason for it. For example, you don't have a medication that is causing that. You don't have an illness in the anorectal muscles or function that is causing that. You don't have a malformation or a congenital malformation that is causing that constipation. And you can't really pinpoint the reason why someone cannot go to the bathroom, but they have infrequent and difficult bowel movements. And the word saying chronic means that it has been lasting for several months. So majority of people who are constipated, when they come to our office, they have been constipated for a number of months, if not years. And that differs from irritable bowel syndrome, the constipation subtype, as pain is not a primary problem for chronic idiopathic constipation. Those patients don't have necessarily abdominal pain as a primary or predominant symptom. While irritable bowel syndrome with constipation or IBS-C, people have a lot of pain that precedes or gets worse or is associated with bowel movements. So that's the primary difference, is the presence of substantial pain.
And what are some of the more common causes of chronic constipation that people might not be aware of?
I think that a lot of things that are out there that people, if you did a quick internet search, you would find some quick fixes for constipation, and they're not far from the truth. I mean, inadequate water intake is a problem because you cannot then lubricate your stools to have a soft and easy bowel movement. Inadequate fiber intake. We know that the majority of population in the U.S. does not eat enough fiber for what they're supposed to be eating, which we estimate at least 25 grams of fiber per day would be the minimal adequate amount of fiber in a day. Majority of people don't get to that. And then a lack of movement, body movement. And I'm not saying you have to go to the gym and work out for 2 hours to consider that movement, but just be physically active. Moving around throughout the day helps having a bowel movement.
How is it diagnosed? How is chronic constipation diagnosed?
That is a clinical diagnosis, meaning you don't have to necessarily do lab work or tests, although sometimes those tests are done depending on what associated symptoms the patient comes in the office. So let's say someone comes in with new development of constipation for a few months, but they also have some somnolence or feeling very sleepy throughout the day, when they're losing their hair, and they have some other non-specific symptom, maybe a cold intolerance. You would test for a thyroid disorder, for example, in that particular scenario. But you don't necessarily need to do those tests as long as you're asking all those questions and making sure you're excluding other causes of constipation that would be not necessarily in the gut, but outside of the gut and influencing that. For example, reviewing a medication list, a common cause of constipation that is more and more common is chronic pain medication. So opioids can slow down the gut substantially and cause worsening constipation. Some supplements can also worsen constipation, and people are not aware of that, such as calcium supplements and vitamin D supplements can make your bowels move not as fast as they were before. Not that that would be a primarily cause of terrible constipation, but it could slow down your gut substantially.
And we know that there are many people on those weight loss drugs, and one of the side effects that we hear is everything slows down, and that also affects the ability to have regular and normal bowel movements. So is that another question that might be asked as well?
Yeah, that's not uncommon at all. In fact, I think the primary care in the obesity medicine doctors and the endocrinologists who have been prescribing those GLP-1 medications, they have been doing a good job at least providing some reassurance that the constipation is expected and will happen. They only get to our office in the GI office if they had already some constipation beforehand, and that got substantially worse with the medicine. Sometimes it's just a dose adjustment and they will be fine. Sometimes we do need to add a little help with pharmacological things.
So this is a really important question. And, I know even from watching my own grandmother through the years with her Senokot and Correctol, and, a lot of people try to self-medicate, right? They're buying laxatives, they're buying supplements, they're taking all these things, and they're still not getting relief. And what are the warning signs? Like, when is it time to see a doctor or gastroenterologist? Like, when? Like, how do we know?
Okay, so that is a complex question to answer, but I think, for example, for the person who has chronic constipation, the moment they notice a change in the pattern, that should be a red flag for them. So let's say you're normal, or your so perceived normal is to go to the bathroom once or twice a week, and now you go less and less and less frequently, and you notice yourself reaching for more and more laxatives, particularly the stimulant laxatives like Senna, and then those would be some warning signs. Something is different. Something has changed. And then other associated symptoms would be if you lost appetite because you feel so bloated, or you have terrible reflux, feeling that you have more and more heartburn because you are not going to the bathroom. So that works like a clogged sink. Things are not moving downstream. You're going to feel upper as well. Then other things would be if you had some other symptoms that should scare anyone, constipation or not, would be unintentional weight loss, meaning you're losing weight, you're not trying, you're not exercising more or eating less or changing your diet with that goal, and you're still losing weight. If you had blood in your stools, those would be warning signs as well.
You touched on some of the lifestyle factors that could impact that. Dietary. Are there dietary factors that we should be concerned about?
Diet-wise, if you're looking for something that is simple and not going to break the bank and not going to cause any side effects, and you are on the natural, try to manage your symptoms naturally, then the 2 kiwi fruits that have been out in the literature recently, and I'm sure if you have read about constipation on the internet recently, then you came across some about that literature, that 2 kiwi fruits a day have excellent results for a majority of patients who have constipation. But I should say that a lot of times the patients come to the office and they're doing everything right. They're drinking their water, they're eating their fiber. They sometimes come with a food diary and with the fiber grams, the amount of fiber they're eating in a day. And they're exercising, they're doing everything. And it's not your fault, okay? Your bowels are not helping you and you're doing everything right. So I don't want anyone to feel ashamed of being constipated, because sometimes it does not depend on you. The same way that someone shouldn't feel ashamed about having hypertension or diabetes. Those things happen, and that's why modern medicine exists, and we want to help you. So, but the 2 kiwi fruits a day are an easy recipe. If you don't have any allergies to that, then I would definitely give it a try if that works. That's healthier and a good option for managing mild constipation.
And what are, if someone goes in and you figure out, you ask them the right questions and you say, you have chronic constipation. What are you going to tell me about my treatment options? Hey, doctor, I know that I see these commercials, that there's these new drugs I can take, but then there's this like capsule thing. Like what, can tell me what my options are and what I need to know.
Okay. So usually my recommendation would be first to discuss their diet and see if there is room for improvement. Sometimes there is room for improvement, but the patient cannot or is not willing to, make the changes to achieve that amount of fiber that they need or the amount of water they eat. Life is tough, and I don't want to put more burden on anyone. If there is a room for improvement and a will and an ability to improve their diet, then I'm all for it. Of course, addressing the mobility, moving your body helps get your bowels also moving. And then if we don't have room there, or if we cannot attack from that end, then I would discuss first some over-the-counter safe options. Polyethylene glycol is a good option that is over-the-counter. And then the Senna, Senna formulations have been on the market forever, and they also help. Sometimes patients notice that because that's a stimulant laxative, they have to reach for more and more and more over time. And that puts a little bit of uneasy feeling. And it's not my favorite because it can cause some cramping and other things. But for the occasional constipation, that's a good option. And then after that, we can talk about prescription things that you cannot buy by yourself as a patient. So then we talk about medication options. There are several more recent, I think in the last 15, 20 years, we have developed some different drugs that can really help. They help by essentially stimulating the gut or bringing more water into the colon to get your the bowel movements to be softer and more liquid and easier to pass. And then more recently, this vibrating pill came out, and that has been a new option for patients who don't want to take something that is a medicine, but they are willing to take something by mouth.
Okay. We want to know more about, we want to know more about this capsule. So, and I like how you told there's the 2 types of medications. One brings water into the colon and one stimulates the bowels. And you're talking about this capsule. Would you present to me all these options? And I was like, I'm really interested in this capsule. Like, how does it work? What do I need to know?
So the capsule is a new treatment, came out, I think 2023. I only prescribed it for the first time in 2024. So, and I have limited experience with it as far as like number of patients. I don't have 100 or 200 patients on it. I have a few patients who take it. But I learned a lot about it because I'm close friends with a patient of mine who works with me. So she has shared some information with me that I probably wouldn't have known if I didn't have a patient that was willing to share that. So I'll share what I know, and then Misty can probably chime in and add some more info.
Yeah, we definitely want to hear her experience with this. So I guess we'll start, like, what is the Vibrant capsule and how does it work to relieve constipation?
Okay. So the way our bowels work, they have like an intrinsic nerve system in them. And that nerve system kind of stimulates the bowels to move and kind of squeeze the food bolus and then later on the stool to the end, to the rectum. So you can actually have a bowel movement. So for some patients who have chronic constipation, they go several days without having the urge to go to have a bowel movement. And we think that that's probably related to the lack or slow motility in those nerve sensors. So the way this vibrant capsule works is that you activate this capsule, okay? And the same way you take it, the same way it's going to come out. It doesn't open or release any type of medicine. It works by shaking your gut, essentially, from the inside. And it's, as you are taking it, it's activated, but it's not shaking yet. When you swallow it, it goes down your swallowing pipe, goes down your stomach, inside the small bowel. And then after a few hours, it starts, moving and shaking, like the same way that the phone vibrates. It's kind of that same sensation. Most patients in the trial that they did to get FDA approval did not feel the capsule shaking. Some patients do feel it. Misty can share her experience. And so the way it works is that it stimulates the gut to kind of waking up those nerve cells and mechanoreceptor sensors. And then they essentially make the bowels move more or faster.
This is so interesting. So who would most benefit from this? Who should use it? And when do you think it should be prescribed?
Anyone with chronic idiopathic constipation that does not have an issue that would obstruct the colon, essentially. So if you don't have any problem swallowing a large pill, then you could use this. If you don't have any problems in the motility necessarily of the gut that really, really slows down the stomach, for example, like gastroparesis, you could use it. So the chronic idiopathic constipation patient is the perfect patient for the Vibrant pill. You do have to, I think as of now, the requirements for you to have any type of coverage for it is that you have to have used some type of laxative for the last month. So it's not even a very strict requirement, I don't think, for this pill. And the price is not bad. I mean, I asked we went through a lot of research before starting to prescribe this because I didn't want to incur a high cost on my patients, and the cost hasn't been bad. So, and I think that insurance companies are starting to cover it.
So this is a really viable option. And it has shown safety and efficacy in trials. Otherwise, it wouldn't have been approved. So this is a really strong option for someone who maybe doesn't want to take. I don't like taking a lot of medicines. And I'm one of those people. So like if I came to you, this could be a really good option for me. Along those lines, like how does it work? Like, do you write me a prescription and do I take it every day? And it's like the same capsule. It goes out in the toilet, obviously. And then I would take how do I, and we'll talk, Misty, we can't wait to talk to you soon, but how often do you take this?
So you get a prescription, and I believe at this point there's only one distributor for the tablets, but you get 20 pills a month, and you would take 3 days. You take for 3 nights, and then you stop one, and then you take 2 nights, and then you stop one, and then you go on to take 3 more nights. So for 7, let's say a week, you would take 5 days, 5 nights.
So it's like a capsule, almost like something like a vitamin capsule that
it's
you
like
would
a
take.
large
looks like that.
Think of a large multivitamin. That's the size of it. It's made of the same material as the PillCams that we do, sometimes the PillCam or the video capsule endoscopy. If you've ever heard of that, that's the same material. You get 20 individual per month, and when your renewal comes in, you will take the 20 new ones. So you don't have to fish out the capsules from your poop. It goes down the toilet. You can flush it.
Good.
You can flush it out, and it's sifted through and in the collecting system. Yeah,
that's great. That's great to know. So, we'll ask Misty, how easy it was to use and all of that. From your experience with your patients, are you finding that it's been effective for them?
Yes, it definitely has. And patients, the patients that are on it definitely are grateful to have another option, because one of the problems that I had with one of my patients who's taking this is that they were already taking a lot of medicines for other conditions, and they didn't want to add another thing that could interfere with that. There's a sensation of predictability because some of the newer or the prescription medicines for constipation, they can cause kind of a sensation that you have to rush to the bathroom to make it because it's going to be very liquid stool. And this has not changed, at least my patient's report has not changed necessarily how liquid your stool is. it doesn't cause diarrhea.
So that's a really great point, because that's one of the things that we all fear if we're taking those stimulants or the ones that add a lot of water to our bowels, that we have to run to the bathroom and we'll have an accident. So this,
Yeah.
if I'm just imagining how it will work, it's when your colon isn't moving, it's a muscle, right? It's a muscle, and that and has nerves that kind of pull it through, right? So this kind of activates that. So it will give you the normal, almost a normal way that it moves to help pass the stool. Does that sound
correct?
Right. So that's very interesting.
That's the whole idea behind it, is to kind of stimulate your natural nerve sensors and nerve, exactly, your nerve stimulate to the gut.
And can this be used? Is it intended for short-term or long-term use? Do you find that patients can, go a longer time before having to take the capsule? Do they find their natural rhythm with this? And I know you said it's pretty new, so there hasn't been a ton of, studies.
Yeah,
about
it's pretty new.
Yeah.
I don't know if they are doing any studies about that. So far, my patients are taking it as prescribed. We haven't tried to change anything. And I bet that the patients that I have would be hesitant to change when they are winning, when they're winning the game, it's working. So, I mean, although majority of patients want to come off of medicines as soon as they can, chronic constipation, there's no cure for it. Once you made those modifications in your lifestyle, the diet and the exercise and the water intake, and that really hasn't led you to sufficient progress, and you are depending on taking something, we're not going to be able to cure that, but we can find different strategies that work. And oftentimes what happens is that you end up, and Misty can share her experience, is that you will take one medicine, it will work for a few months, or maybe if you're lucky for a few years, and then you have to change to something different because that is no longer working for you. So having another option that is not a medicine maybe will add more to this arsenal. The amount of options that are out there, and some medicines have contraindications or interactions with other medicines, and this does not. So far, I have liked having this option, and I haven't had any issues with the patients. All the ones that I prescribed, they have been happy with the results so far.
That's great news. So do you find that your patients can still maintain a lifestyle and dietary habits that they're used to while using the capsule? And also, if they're on other things, like maybe they're also taking some extra fiber, can it all work together for them?
Yeah, absolutely. So since this does not have any pharmacological agents, like it's essentially just a vibrating pill, it doesn't release any substance into your body. You can continue to take whatever you need to take. If you take high blood pressure medicine, if you take diabetes medicine, or if you take a fiber supplement and you want to continue that, or your vitamins, you can still take them. The activation pod is pretty user friendly. It looks like any other electronic that you would have in your house, like one of those Alexas or any type of Google helpers, the secretaries. It's not a big thing, I think, for people who travel. Misty has mentioned that she has traveled with it and it worked just fine, so she didn't have any issues. And, you activate the pill, and by the time you take it, it's not shaking yet, so it shouldn't be unpleasant.
So, before we talk to Misty, I wanted to ask you, what would you say to providers about this, and, taking giving this as an option to their patients? Like, what would you tell them? Like, if they're like, oh, what about this vibrating capsule? What do you think? Are you prescribing it to your patients? What would you tell them?
I think that it of course, it depends a lot on your style and how you practice. But one of my teachers in medical school used to say that you should never be the first one to prescribe anything and never the last one. This option for treatment has been on the market for a little bit, and the results are pretty good. The trial has been solid. I mean, it shows some results. Is it going to be the only and last option for treatment of constipation? No, it's not. But it's a good option for all those patients that have been kind of frustrated with what the options that they had, or had a lot of side effects, or they're losing effect. Each new medicine they start, they work for a little bit and then they don't work. And this can be another one that can work. And maybe it works for a few months, maybe it works for a few years, and maybe it works for many years. So I think I was willing to try mostly because I think that hearing the frustration from the patients from going from medicine to medicine to medicine and nothing really helps or give them significant side effects, I think why not? This is a safe and FDA approved option. Why not try it?
Misty, thank you so much for joining us today. I'm so excited to hear about your experience with the Vibrant capsule.
Nice to meet you. Nice to meet you.
So first of all, can you just give us a little background of what your health situation was that led you to try the Vibrant capsule as a treatment option for your chronic constipation?
I've always suffered from constipation, but after gastric bypass, it got way worse. We tried everything from like over-the-counter medicines to like old school trial remedies, and we went through prescriptions. I tried pretty much all the prescriptions, and then last ditch, Monia was like, okay, you want to try this? I've never had anybody try it before. And I said, well, I don't have anything else to lose, so let's just try it. And so before I started the pills, it was every 6, 7, 8 days. And then now the pills, it's every 3 to 4 days, but it would be more if I still do Miralax every couple of days. So that kind of keeps it at that 3-4 day level.
So when you say 3 to 4, does that mean bowel movements or how many times you take the Vibrant capsule?
No, bowel movements. The capsule works. You get 20 a month and you take 5 a week. So you take 1 night for 3 nights and then you skip a night and then 2 nights, skip a night, 3 nights, so forth.
So I'm going to ask you the $1 million question that I'm sure everyone is curious about. Take us through your first experience with it. And, you take it, did you take it at night? And then how does it feel, going down? And then do you feel anything in your body like that? Everybody wants to know this.
So I take it at night, and I had to okay, it's fine. You're going to swallow this. It's not going to get stuck, and just take it with a bunch of water. And I took it and it was fine. Went down fine, no issues. And then it was probably about 2 days, and Dr. Werlang was like, do you feel it? Does it feel funny? I was like, nope, don't feel anything. And then I'm at work one day, and she's in the room adjacent to ours, and I'm standing there in a case, and all of a sudden I kind of felt something, and I was like, oh, what is that? And then I counted like how long it felt was like 3 seconds. And then it would stop for 14. And then I would feel it again. And I'm like, oh my God, I can feel it. And so I ran into her room, and she was like, what? And I said, oh my God, no, yeah. And she said, did you poop? I said, no, but I can feel it. And she's like, are you serious? I said, yeah. And where I felt it was so embarrassing. And she's like, it felt like it was in my butt. So she's like, okay, it's working. And then I didn't feel anything for a while until it was probably about 3 days, maybe. I was in the shower and I could feel something on my right side. And so I would push in and I could feel it. It feels like a little bumblebee, just, and I guess right side, it's your seat, and it was in my cecum.
There's no pain. You didn't have any pain.
Nope.
Now, in full disclosure, you're a healthcare professional, so you're very aware of your body and everything, like more than probably most people would be, right? You're very attuned to everything.
Yeah.
So was it a light? It wasn't like you're sitting there in your chair, like this. Okay,
no, it kind of feels like butterflies in a way. Just like when you get like a butterfly feeling in your stomach, it kind of feels like that a little bit. But it doesn't hurt. It's not like painful or annoying. It just, no. But yeah, it is. It's funny. It was funny at first, and now I'm kind of used to it. So when I feel it, it's nothing big now, and everybody at work's already felt it.
Oh, but you can actually feel it because it's probably like really close. Okay, interesting. So, I mean, in a way, it's kind of good because it's working. And how long like after you feel it, doing its job, did you have your first bowel movement?
So everybody asked, like, can you see it? And I'm like, no, I have not seen it. And so, I don't know how many pills I've swallowed before you have a bowel movement. I can't tell you that.
Oh, okay. I see.
Yeah.
Oh, I see what you're saying.
So I just know I can feel it when it's on my right side. And I have felt it a little bit in my back before, but it's mostly in my right side is when I usually feel it. But yeah, that was the other $1 million question. Like, can you see it? And I'm like, no, I have not seen them. So,
but this is so interesting. So how does your experience with the Vibrant capsule compare to other treatments that you've had, in terms of the efficacy of it and how it's working for you?
It has pretty much been a game changer. Like I said, we tried everything, and Miralax, all the gastro doctors push Miralax because it's better for you, but it wouldn't even work. And started taking the capsule. And now when I take the capsule, if I don't take any Miralax, it kind of moves it to 4 or 5 days. But if I take the Miralax, and I tried to take it every day, and that was just way too much. So I take it every 2 or 3 days now at night. And with that paired with the capsule, it helps a lot. And it's funny because everybody at work knew before I was miserable. My stomach always bothered me, and I was always hurting and in pain. And everybody knew when I was, because I would just be walking around rubbing my stomach. But now it's been a big game changer. Even my mother noticed when we went back home a month ago that, I could tell you feel better. And I was like, yeah, it's miracles when you can poop.
That's amazing. So how easy was it to fit this Vibrant capsule into your life? And how easy was it with traveling, going to work? How does it fit in?
So it has a little docking device that you activate the pill in, and I just keep it in my bathroom, in my bedroom. And so at night, I take, if it's that night, like tonight's Wednesday, so I'll take it tonight, tomorrow, and Friday. And I just take it with my night medicine and just go to bed. Yeah.
And then just to be clear, now we're not recycling these. Like once it comes out of your body, you have a new one. So just so everyone's aware, I know Dr. Merling told us that earlier, but we're not like fishing them out and recycling them. They pass through your system and you have a new one.
Yep.
That's awesome. So do you find this capsule comfortable and discreet to use, especially compared to other treatments? Like you didn't feel like embarrassed or anything like that?
It's interesting. Even from like outside views that's not in healthcare, everybody that knows about it, family and friends, they're just kind of fascinated by it. Like, who would have thought a vibrating pill could help somebody? One of the colorectal doctors I work with, she was very interested in it because she said, by the time patients get to her, they have to have their colons taken out. That would be worth a try before someone has to go through a big operation like that. I mean, what is there to lose? I mean, it's not going to hurt you. It's more therapeutic in a way, if you think about it, because sometimes taking a medicine for a long time, your body can, get used to it and maybe it won't work anymore. Well, this isn't really medicine. This is medicine in a way, but it's not. I mean, it's more natural.
It's working on the motility and is helping everything to move correctly, which I think is fascinating.
I think it's a godsend. I'm so thankful for the man or the person or the people that created it, to think something so small could help in such a big way.
Well, Misty, this has been so enlightening, and we're so grateful that you shared your experience with us. We really appreciate it. And for our listeners, if you want more information and to learn more about the Vibrant capsule, please visit the Vibrant capsule website at vibrantgastro.com. We'll have those links in our description. And you can also access from the Gastro Girl website, where we have a health hub that is also brought to you by Vibrant Gastro that has lots of great information on constipation, chronic constipation, and some neat information and videos on how this capsule works. So thank you again, Misty.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.